Welcome to the University of Queensland Ochsner Health MD program webinar. Today's topic will be becoming a global physician. Allow me to introduce today's panelists and current students. We will have Marlon Joseph, MD, who's the Admissions and Enrollment Officer. We'll have Sue Barosse, Director of Enrollment Management. We'll have Amanda Lucas. She is in her 4th year here. She's over here at Ochsner Health in New Orleans. And we'll have Dhaval Patel, also a 4th year, currently in New Orleans. All right. Before we begin, let me provide some chat room instructions. You may begin to enter questions in the chat room as soon as the webinar begins. Our chat room facilitators will be able to respond. That's going to be Kathy Harrell and Pete Carlstein. I always mess up his name. I'm sorry, Pete. And I will also be trying to answer questions as well. I will hold some towards the end for our students to answer as well. Feel free to turn on your cameras. And panelist number 1, Miss Sue Barosse, are you ready?
Yes, let me share my screen, everyone. I know it's a little slow. Okay, well, welcome to our webinar, Become a Global Physician. And I love this slide, this next slide, because it shows where we are in the world. So Brisbane is located in Queensland, which is a state in Australia, and it's there on the East Coast. It's a little bit south of the Great Barrier Reef. And there we are in New Orleans. We know where New Orleans is, and we're happy to have you here with us tonight. And here are our panelists, which Melanie has introduced, and want to definitely say thank you to Dr. Joseph for joining us and our 2 current students, Dhaval and Amanda. Thanks for joining us. So what does it mean to be a global physician? And we're going to talk a little bit about that. This program is innovative in that it's a partnership between 2 strong entities. The University of Queensland, which is over 100 years old, has a great standing and is known as to be a really powerhouse institution with research. And it's listed in global universities. It really has a high listing in our rankings, in the world rankings. And then Ochsner Health has been in New Orleans for over 80 years. So this is a partnership between these 2 entities. And this program is geared towards U.S. residencies, and EFCMG certification is part of this program. So everyone would be certified to practice medicine in the United States. And we have alumni which practice all over the U.S. And there's a pathway to practice in Australia as well, if that is what you would like to do upon completion. So as I mentioned, the University of Queensland is in the top 50 as a global university. If you go to U.S. News and World Reports and look for global universities, you'll see it listed around 36, something like that. So it's pretty exciting to be in partnership for us here in New Orleans with the University of Queensland. Faculties, you see there are 5 faculties. That's in Australia, that's how they say there are different schools within the university. And you'd be in the Faculty of Medicine, which is part of one of the schools that's there. And the teaching and research is something that really connected and we bonded on. Research is certainly important to Ochsner Health, being a teaching hospital here in New Orleans, and it's definitely important with the University of Queensland. So in Ochsner, we have over 46 hospitals and health. There are over 300. We have 330 health centers throughout the Gulf South, and we're located from South Carolina, Florida, Alabama, Mississippi, Louisiana, and even a partnership with MD Anderson in Texas. Okay. This is what your 4 years would look like. In the year 1, as you see, what's different about studying medicine in Australia is that in year 1, you can see the last line says 1-day development of foundational clinical skills. That means out of your 5-day school week, right, you're going to have 1 day when you're in clinic and you're learning clinical skills like scrubbing in, giving injections, all the types of things that you need to know when you're in a clinical setting. So it's not just 5 days of your week that you're in lecture, lab, and library. You will have 1 day a week in clinic in your first year. And then second year as well, you can see it says 3 days interdisciplinary learning and teaching. So 3 days of the week, you'll be in class. And then 2 days, you're going to be developing your clinical skills. And this is where you have an observership to learn, to watch and learn how to interact with a patient, how to take a history and physical, how to present that to your attendings. And then eventually you transition into this yourself, where you learn to take history and physical. So it's really amazing to gain that skill in your second year of medical school. Then your third and fourth year, you come to New Orleans, and then you have regular clinical immersions like we do in the US, right? So you'll be going through the different specialties and even have electives that you can go for to other cities, not just all at Ochsner. And Ochsner's clinical immersions are throughout the Gulf South as well. We have Baton Rouge, Louisiana, Bay St. Louis, Louisiana, Colma, Louisiana, Lafayette. So you do treat different populations and interact with different populations when you're here in the United States and Louisiana. I think this is where I kick off to Dr. Joseph. Dr. Joseph, are you ready to take it away?
Great. Yes, I am. Thank you, Sue, for giving that great general overview of what you as a prospective student may encounter if you do choose to come to medical school with us at UQ-Ochsner. So I'm going to talk a little bit more generally about the differences between the healthcare systems in Australia versus the US. Some of you may already know some of these things, but Australia is one of the countries in the world that has universal healthcare, which is funded by the citizens and taxpayers of the country. Now, this has several benefits, as we well know, such as low-cost doctor visits and subsidized prescriptions. And this is, of course, a great benefit to the society as a whole. Licensure is also different for physicians in Australia. It is all done under a national licensing program through the AHPRA, a regulatory body that does this. And this is another difference between the United States. So flipping over to our country here in New Orleans, as well as the U.S. And on a broader range, we have a more mixed system of healthcare coverage. As we know, some individuals have to purchase private insurance on a health insurance market. Many people have employer-sponsored insurance plans, and then there are public options such as Medicare and Medicaid to cover those over the age of 65 in the case of Medicare, and then those who have lower incomes or children, for instance, on Medicaid. As a result, since our system is not a universal payer system, we do have higher costs for visits and prescriptions, especially for those who do not have insurance, which is a big problem, of course, for us in the United States. And then licensing is done on a state-by-state basis. For instance, if you are licensed to practice medicine in the state of New York, you, of course, may not necessarily be licensed to practice in the state of New Jersey or another state unless you apply individually for each and every state. Next slide. So how do the countries differ when it comes to you as a prospective medical student being a patient as well as a future healthcare provider? So as a healthcare provider in Australia, you will be getting that early clinical exposure that Sue mentioned as she went over the schematic mentioning your curriculum. You'll have a wealth of broad public hospitals from which you will be able to be immersed in your training. And this is a really valuable benefit. Um, as a general practice clerkship director, our primary care equivalent rotation here in the States, it's really great to see our students have that clinical exposure before they come to the third and fourth years, because it gets them a leg up in terms of getting into the clinical thinking skills that they need to progress. So in the United States, which you'll be able to get training in the United States as well too, of course, your rotations will begin in year 3 for full immersion rotations, as Sue mentioned, and this will be focused mostly at academic medical centers, which the academic medical center that is affiliated with the UQ, of course, is Ochsner, which is the largest healthcare system in the state of Louisiana. So, of course, as a medical student, you may end up being a patient. This happened to me when I was in medical school. Accidents happen, surgeries, etc. Fingers crossed they do not. But the benefit to you, if you are in Australia, is that as a person also covered by national health care, you will get those benefits in terms of your access to care. And Australia in general has a very strong preventative medicine culture. And this is something that is great to inculcate into your future practice as well. So in the U.S., of course, it's a little bit more complicated than that. As always, we in the U.S. have to have students require to have university insurance, and things may be a little bit more complex to access. Of course, we try to make sure those barriers are diminished for your time when you come with us in the 3rd and 4th year. Next slide. So you may be asking as you sit here, why UQ-Ochsner? Why would I go all the way across the globe to study medicine for 2 years and then return back to the United States? So that's a very good question, and we hope to answer that with this webinar tonight. So there are some intrinsic benefits to having a dual exposure to both the United States and Australian healthcare systems. Healthcare systems are very different around the world, and different perspectives do inform best practices, and oftentimes guidelines are created in a global perspective. You'll also be able to have the flexibility of having developed cultural competency in another continent and adaptability as well, so that you're able to manage different healthcare environments. You're able to manage different patient populations, which is another skill that will make you even more marketable as a student and future resident and attending physician. So that is baked into the broad clinical training I was just mentioning. You'll also build professional networks across 2 continents. One little nugget that is interesting is that you'll get to return to Australia in your 4th year of training as a medical student. So you don't just go for 2 years, you'll get to go back as you have developed clinical skills to do another immersion in Australia. And this is a very desirable experience for our students. You'll develop flexibility in your career pathways by being exposed to a wide breadth of specialties, and you'll challenge yourself, which is just a great thing for development as a person, and develop resilience. Next slide. So this slide is talking about your path to global medical leadership. We like to think of our students as future global medical leaders, and this might be something that calls to you. If you really do like studying evidence-based medicine, being immersed in this globally minded curriculum, being mentored by world-class faculty. The University of Queensland is one of the top 50 universities in the world, as was mentioned beforehand, one of the top 3 universities in the country of Australia, and you will get an outstanding scientific background in terms of your early years of training. So you'll be prepared for a licensure in both the United States as well as Australia. You can be eligible to take the USMLE steps, of course, in order to become a fully licensed physician in the US. And if you so choose, for whatever reason, if you fall in love with the country of Australia, as many do, you can apply for Australian medical licensure as well. You receive training during your medical school years in policy, innovation, and health equality, with coursework that is specifically developed to help you along this dual continent pathway. And really importantly, we have a 97% US match rate. That is in the most recent match in 2025. So those match rates, as you know, are very critical for any medical school to show that we are developing quality students that are attractive to US residency programs. And many of our alumni become chief residents. They become excellent residents, as is manifested by surveys that are performed after medical students matriculate into their residency programs. And you don't have to take my word for it. We have many great videos on YouTube and the other social networks where you can talk to or listen to our students talking to our former students in their current placements. So check those out as well too after this webinar. So lastly, who can apply? So the citizenship requirements, you do have to be a United States citizen or a permanent resident. And you may apply if you are a dual Australian or a dual New Zealander US citizen. However, you have to apply as a US applicant. You cannot apply as a mainland Australia applicant. Next slide. And I think with that, I will turn it over to our awesome fourth year students, Amanda and Dhaval, who will give you a more intimate perspective.
Hi guys. So I was just responding in chat to some people, or to Abby. She was asking about the opportunity for pursuing the MD or the PhD dual degree, and if it's available to UQ-Ochsner students as well.
Would you like if I answer that? Because yes, definitely we do have an MD, PhD combined degree program that you can apply for. During your first year of medical school, there really isn't any research that occurs because the school wants you to adjust into your role as a medical student and get your studying in place and making sure you have a great first year experience. But in second year, you are open to apply research. You're open to research, investigating research, and applying for that degree. You could apply for a Master's of Philosophy degree, and you can apply for a PhD degree. If selected, those research degrees are fully funded and come with a monthly stipend as long as you are in that field, in that degree program.
Thank you so much, Sue, for fielding that question from our students. All right, so Amanda and Dhaval, can you share some of your personal experiences regarding the UQ-Ochsner program and how you feel it has prepared you to be a global physician?
I guess I can start, Amanda. But yeah, so honestly, I think a lot of medicine nowadays is becoming more and more global, especially after the COVID-19 pandemic. And I think me and Amanda were fortunate or unfortunate enough to actually go to Australia right in the midst of the pandemic. And I think that was very much eye-opening experience in terms of just seeing how different things were going in Australia compared to the US. And not just like within like experiencing it, but then we started learning more about the healthcare system itself, because a lot of like there's a big focus in the curriculum on like public health as well. So not only did we know a little bit about the American healthcare system, but we learned about it, the Australian healthcare system. And I think it just helps you realize that there's a variety of ways that you can practice medicine. And it's kind of coming back to New Orleans, and I mean, just in the US in general, US medicine tends to be more test centric or number centric, I like to say. And I think in Australia, comparatively, it's more exam driven. And I think just being able to see that in like practice kind of helps open your eyes. Like you can choose to be the kind of physician you want. And I think just going through that, it made me think a lot more about the decisions I make. Before, like I say, let's order a CT scan or like let's get like these labs done, because that is not available everywhere. And obviously, like it comes at a cost. And just being able to think about it, I think you can make it easier on your patients.
Yeah, absolutely. I agree. The thing for me about UQ-Ochsner that was important was trying to find different perspectives about how practice works in different parts of the world. So obviously the structure of healthcare itself is a little bit different in Australia and in the US, and that's quite the topic of debate about what the best way is to practice to help deliver care to patients. And I think it's been really useful as a student to be able to see different formats in action. And one of the things that's interesting is I think sometimes it's hard to realize when things are sort of medical science versus when they're Americanisms or Australianisms, as they were. And so, like Dhaval was saying, things like when we order certain tests or how we sort of structure the way we think about these things, it can be very different in different parts of the world. And getting to see that helps to challenge your thinking. And I think it makes you a better physician to be able to rely on these different perspectives and know that, having a little bit of flexibility in the way you approach healthcare and in problem solving in general can be really beneficial.
Thank you guys for sharing that. This is in the similar vein as well, but was the idea of becoming a global physician a significant factor when you applied to the UQ-Ochsner program?
So I was actually I was pursuing some graduate studies in public health at UQ when before I started the UQ-Ochsner program, and just learning a little bit about the healthcare system during then, it definitely like made me want to learn a little more. And even now, like it made me more interested in just understanding like healthcare systems overall and just medical education systems, because there's big differences between just like American and US healthcare, and not just like healthcare, but also like the education system. So yeah.
Yeah, absolutely. As part of my undergrad work, I spent some time living in Denmark and exploring sort of how healthcare systems work in most of Western Europe. And it was really interesting to see the different formats that sort of come to exist. Of course, the NHS is sort of a classic example, but really all across Western Europe, and Australia as well, which has a fairly European healthcare system. But yeah, it's incredibly interesting. And I think being able to challenge structures and understand, see where flaws are and where there's room to improve the way we help people. And the best way to do that really is just to see it yourself. So absolutely.
Thank you guys. That's awesome. So my next question is, can you talk about your experience treating diverse populations and what benefits you've observed? Since we do have such different populations between Queensland and New Orleans.
Yeah, for sure. I think in general, like first of all, like I think our curriculum has a big focus on working with diverse populations. In the first 2 years, we do a lot of learning on like indigenous health. And then New Orleans is obviously very diverse city, and not only do we get to be at main campus, but we also have the opportunity to go to like some of the surrounding Ochsner hospitals, which also increases like the type of patient population that you see. And I think just from the get-go, like your day to day just ends up being so diverse that you end up learning to think like nothing phases you, and you're very comfortable like having tough conversations, not tough conversations, but like um, conversations that respect diversity pretty well. And yeah, I think it's definitely one of the major benefits that you get out of this program, because you do it not just across like the city of New Orleans, but you do it like across Louisiana as well as Australia.
Amanda, did you have anything to add about the diverse populations that you've seen?
Yeah, absolutely. So in New Orleans, in general, there's a diverse group of populations here. Ochsner in general cares for sicker patients than you would see in your typical clinical setting. And so there's an important need here for people who are very aware of sort of socioeconomic factors and managing illness in these patient populations. But being able to bring back what I learned in Australia to my hometown has been really special for me. So.
That's
Those are
awesome, especially when you can apply it to your hometown. So Swathi has a question for our students. What was it like to move to Australia on an academic and personal level?
I think for me, it was a big change, for sure. And in the beginning, it was kind of tough. Not only you're adjusting to like medical school, which is much harder than what undergrad used to be, but now you're in a completely unfamiliar setting as well. But I think honestly, like we have a really good group of people over there, and just our class is very supportive overall. So a lot of the second years end up helping out like the incoming first years. They help with everything from like house hunting to like just general like, hey, like come hang out with us. And I think that definitely makes it easier. Amanda was actually one of the first people I met in Australia. We have small teaching sessions, and me and Amanda were in the same group. And it was nice to have someone who was kind of going through similar experience as me, but also like we're very integrated into like the rest of the student population. It's not just the Ochsner students together. So I think it was very nice to be able to learn from a variety of different perspectives, but also having a good friend like Amanda definitely makes it easier.
Yeah, I think, really no matter what your background is, moving across the planet is always sort of a challenge. It tests you and it asks you to be your best self. But I think that's sort of the exciting part of it all, really. I think everyone sort of learns a lot about themselves, particularly in those first 2 years as you're learning sort of who you're going to be as a medical professional. And like Dhaval said, the Ochsner students do a really great job of coming together and sort of creating a team environment. It's not at all a sort of competitive at each other's necks type of place. It's everyone's here to support each other. And of course it was an exciting opportunity to get to learn from the Aussie students as well.
Thank you guys. It definitely is so nice to hear when we have such a collaborative cohort. And the UQ-Ochsner program has always been super collaborative with our students. It's amazing to hear. So Emma has a follow-up question. What were some of the challenges you faced coming back into the US healthcare system after being in Australia for the first 2 years?
To be honest, I don't think I found it too challenging coming back. I think we, like, growing up in America, we're definitely familiar with the healthcare system, and like being able to jump in and apply the skills is pretty easy. I think the only difference is sometimes like they have different like brand names for drugs and stuff. But I think that stuff like you adjust to so quickly that you don't even notice. I think the experience is pretty seamless also because a lot of the like everyone here is familiar with us like having spent the last 2 years in Australia. So they definitely make it really easy to just like, yeah, like that's what you were doing in Australia, but here, let me show you how we can do it here. So I personally I didn't find it too challenging. Um, Living in New Orleans, I'm from the Northeast, so it was definitely like the adjustment was to the city. I don't think it was too challenging to adjust to the healthcare system.
Yeah, New Orleans is definitely a unique place. I had the fortune of having lived here and then returning home, so that was really quite nice for me personally. Yeah, I don't think it was really so much of a challenge from like a healthcare systems perspective or like a working perspective. Of course, it's always a little bit sad to move away from all the new friends, but of course, we were lucky to be able to bring our Ochsner friends home with us. But yeah, people here in general are very happy to teach and very happy to engage, and so I don't think we really ran into too much trouble in terms of translating anything we learned.
That's good that there weren't too much difficulty transitioning. So I'm gonna kind of throw a wild ball at you guys. Everyone always asks Sue and and I think Dr. Joseph, when we're recruiting, about the support available to our UQ-Ochsner students for step 1 and step 2. Would you guys mind sharing some about that and how, it really relates to being a global physician because you're studying for an American test while overseas?
Well, to be honest, I think the first 2 years of like UQ itself, they've done a really great job like integrating the basic sciences with the clinicals. And there's definitely stuff that you need to learn, but I think UQ like at Ochsner, we get a lot of resources, like Boards and Beyond. And honestly, everyone's just really willing to like point out like, hey, like this is how you should study. So I think a lot of us don't find it troublesome at all. And during our second year, there's a step 1 course, and they're changing it this year where the step 1 course is in person. So I think it makes it easier for like you to come together and just focus on step itself during second year. Also, I think it brings the class together because it's the first time, like we're split across 2 countries. So a lot of the fourth years would obviously not know the first or second years. But having like the fourth years kind of be part of helping the second years like get a jump start on studying for step kind of brings it like in a loop where you can connect with people that you don't know. But I think in general, there's really great support for step 1. And I think it's just getting better with the new curriculum because it just changed this year. So they're doing more and more to cover any deficiencies that they had in the past. And I think step 2, I mean, we're back in the States, and I think the experience here is phenomenal. Like a lot of the rare diseases that you learn about, like that at other places you would never get to see, you get to see them here. So I think it makes it pretty easy to prepare.
Yeah, I think there are a lot of avenues for support, both in Australia and once you return. So there's the support team that is entirely based out of UQ in Brisbane. There's the Ochsner support team. Both teams are available to you across all 4 years. And then, of course, you have your peers who are also studying for this big exam. Step one is sort of the big scary exam that everyone worries about when they start medical school. But in practice, even though you're learning from Australians and from really people from all over the world, you're learning the things that are going to be on the exam. Just because it's an American exam, it's not really a separate thing exactly. And then, like Dhaval said, we have a course that's really dedicated just to the exam that's going to be really helpful. But everyone is really in it together. And again, there's a lot of community about studying for step one that I think really makes the difference. And then, of course, step two is back in the United States. And it's really much less of a scary beast than step one was, I think, for a lot of people. But yeah, the support systems are definitely there. And both UQ and Ochsner as institutions are, well, have the resources to step up and support.
Thank you guys for sharing that, because Sue, Dr. Joseph, and I always get questions about, support for STEP. Sue, I think this might be a question for you. Emma is wondering what the timeline looks like for applying to the UQ-Ochsner program.
Yeah, I saw that. Thanks, Melanie, and thanks, Emma. So the timeline, we always have 2 application cycles open at the same time because it might depend on when you're taking the MCAT. And each year we continue to interview until we fill the class. And we're looking to fill 90 to 100 spots. So we're currently filling the spots for the start in January 2026. It's not full yet, but it's getting close to being full because we're towards the end of the year, right? So you can apply to either cycle right now to start in January 2026 or January 2027. Once we fill our quota for and meet the class limit for this January 26th, we will close that application and then we will open for 2028. So we'll have 2 cycles open at the same time. Class always starts in the end of January, beginning of February, and runs through the entire calendar year until probably the end of October, where you will have a study week and then an exam week and come home to the States sometime in November.
Thank you so much for that clarification, Sue. So we have another question back to our students. Don't know who it's from, but they're wondering, what are some of your extracurricular highlights and favorite experiences from your time in the program?
In terms of extracurricular, I think this varies very widely, just because there's so much to do across both UQ and Ochsner. For me, I think my favorite thing has been being able to get involved in like medical education. And so like during year 2, we have the second years run step 1, 2, it's for the first year. And so I was really fortunate to get to do that. And then this year I'm both me and Amanda are we're just preparing to head back to Australia in 2 weeks actually. And so like I'm gonna be plugged back in again to help students prepare for step 1. I think for me, it's just one of the things I want to do in life, and just being able to do it such early on was awesome. And in terms of experiences, I think a lot of my favorite experiences just come from the small group learning that we have during our first 2 years. Amanda was one of them, and one of my friends in there, and I think it's just you're with a doctor, you're with like 7, 8 other medical students, and you just get to try to figure stuff out together. And I think it makes for just a fun learning experience. And yeah.
Yeah, I definitely look back on the CVLs fondly. There were some really good ones in there for sure. As far as extracurriculars, I think one of the things that's been most enjoyable to me has been the research extracurricular stuff. And again, I mean, like Dhaval said, you can take that in any direction you want. There's plenty of good research available at UQ. There's plenty at Ochsner. And so it's been a really exciting opportunity to work with people from different parts of the world. I've gotten to work with different students on research. I've gotten to work with people who have more public health background, people who have more medical background, people who have more hard science background. And so that's all been really exciting for me over the past few years. it actually sparked more of an interest in research than I thought I really had. So that was a pleasant surprise for me.
We love to
Yeah,
hear
and
that students are getting their interests sparked, especially by research, because both institutions do that very well. I think they collaborate really well together. Lillian has a question for both of our students about what specialties you guys are hoping to match into, and do you guys plan to be involved in global health or public health in your medical career?
so I'm applying internal medicine, and so yeah, actually, especially like having stayed in New Orleans these 2 years, I'm definitely a lot of the programs I'm looking at, including Ochsner, have a big focus on working with like underserved populations, and it's definitely a part of like what I want to do in the future. Yeah.
Yeah, so I'm applying for anesthesia, and also really looking for a global health experience. There are a number of good programs in anesthesia these days where you can actually spend a fair amount of time getting to practice and training in other countries, which is really exciting. And so that's something I'm hoping to carry forward as I go through my training.
Thank you guys for sharing your specialties that you're looking to match into. I have a question for Dr. Joseph. Dr. Joseph, what is it like teaching our UQ-Ochsner students? Because you see them in the 4th year, correct?
Yes, I do get to see wonderful students such as Amanda and Dhaval in the 4th year. And since I head up the general practice clerkship, which is the primary care based rotation. So it's great because I get to interact with the students in my own clinic as well as through problem-based learning groups when I participate in those, as well as through lectures. So I get to work with students, I treat them or try to treat them as colleagues, since they're at the very last step of their training. You know, they're all pretty sharp, as you can see from this webinar, and they're just really excited and motivated to get that MD in a few months and to go out there and be great physicians in the world. So so it definitely gives my day a lot of joy, and I'm just really proud of these students. So great question.
Thank you so much, Dr. Joseph. We always love having, your input and your knowledge base join us. So I guess we're going to go back to Amanda and Dhaval. What are you most proud of as UQ-Ochsner students? Since you guys are, it's the end of August now, graduation's coming up. So what would you say you're most proud of?
I've been realizing now that I'm about 8 weeks out from finishing how far I've come, and looking back on sort of where I started, I'm proud of myself for sort of all the distance traveled in the meantime. I've been in Dr. Joseph's GP group this past few weeks. And so I've been doing a lot of, seeing patients on my own and trying to sort of act more independently as I'm finishing off the last few weeks here. And I think, 4 years ago, I never would have imagined being quite so comfortable and quite so excited to see patients on my own and to feel like I really have a good grasp on a lot of things. So I'm excited, for the rest of my training and to see where I go from here. But
Yeah, kind of similar to Amanda. I think all of us started first year as like very timid medical students, and I still remember the first time like talking to a patient without like anyone in the room and like struggling to put words together. And I think that was one of the best things ever because they allow us to do that. They allow us to just talk to patients by ourselves. Um, and obviously, like it's frightening when we do it from the get-go, but it really allows us to just build like rapport with patients and just become really comfortable talking to patients. And I think now just being able to walk into a patient's room and have a casual conversation while being able to elicit all the information we need, I think it's truly an amazing thing. And in general, I think just the amount of things that I've been able to do in terms of like get involved with different groups here, work with different populations. I think it's all amazing. And like looking back at it, I think I'm definitely like me and Amanda actually worked on a project together. Like I think just little things like that make me really proud.
Thank you guys. We love to hear what makes our UQ-Ochsner students proud. I think this question is for Sue. They're asking about our match rate in the chat. Miss Brittany is.
Hi, Brittany. Yeah, thanks for your question. So we do have all specialties here and we do match in them. So our match rate is amazing. Out of the last 10 years, this program's match rate has surpassed the US match rate. So there is that stigma with being an IMG, and we certainly are that, but the match rate speaks for itself. I think this is a testament to my employer, Ochsner, who has been in a teaching hospital for over 80 years. Residency programs know Ochsner really well. So they know the caliber that our students are trained to, and our students do become sought after in the match. So I would say do some, speak with current students and sign up for one of our one-on-one sessions with students and get their take on it, but we do match in competitive specialties.
Yeah, and then check out those videos on YouTube as well. There are some great alumni videos that chatting with some of our students about their experiences getting into certain specialties.
Thank you, Sue. Thank you, Dr. Joseph. And Pete actually just popped in some extra information about our match rate into the chat. So I think that's it for all our questions. Thank you so much, panelists, for joining us. I really hope that this has inspired some prospective students to want to, look further into our program, look at some of our past webinars and sign up for future webinars with us. All right. Well, thank you guys so much. I appreciate everybody for joining us. And I really hope that you have some clarification on how this program will help you become a global physician. Thank you, guys.
Right.
Thanks, guys.
Thanks, everyone.